health is an amazing vector, an amazing factor to bring development and beyond that economic growth.
There is a real debate taking place as to whether we as Europeans can actually afford the type of aid budgets that we have in place. And I am afraid that there are populist parties out there today in Europe that are selling a very misleading message to Europeans, and we have to ensure that they see the greater and wider picture for what it is. It's essential that we as parliamentarians start setting out the stall as to what we expect the new Commission programme to be and how we expect the Parliament to carry on dealing with these development issues.
Health was one of the central aspects of the Millennium Development Goals back in the year 2000, and part of the reason why there's been such progress since 2000 is because there were clear, measurable, targeted goals. And so I think whatever comes next needs to build on that success, and in terms of maternal and infant mortality, in terms of access to antiretrovirals and important medical interventions, it's important that the health agenda stays high on the priority list.
Health is not only a tremendous investment, and we look at it in terms of vaccines, for instance, it's an incredible investment in that you put €1 or $1, you have a tremendous impact, you have a traceable impact, you know what the money, how the money is used and what impact it's got. Your investment translates into savings in the entire health system. It translates into more productive people, which means at the end of the day, economic growth.
We have managed in most countries to reach about 80% of the population, and now comes the difficult task, how to reach the other 20%, how to reach the fifth child, and that is more difficult than the other 80% because these are people living in very remote places. They are perhaps not used to go to health services for their health care.
The countries are financing their own purchase of vaccines, and if you look at the trend from the last 5 years and into the next 5 years, this amount of money that is mobilized domestically is increasing tremendously. After a certain threshold, they should be able to fly with their own wings, and what we're trying to do in Gavi is equip them so that they find the fiscal space and the energy to continue the vaccination.
Many of the poorest countries, they spend something like 15 euro per capita per year. For example, us in Europe, we spend 3,000 euro per capita per year for health. And people nowadays watch TV. They want the same health care as you can see in an emergency room in their countries. Now, how can the governments do that at 15 instead of 3,000 USD? We are trying to work with them to solve this impossible task.
It's not an impossible dream to have access to healthcare for all of the people in the world.